Hi, my name is Dr. Ian Storch. I'm a gastroenterologist in New York. We are putting together two short videos. This is the first one. We want to describe, or I've been asked to describe by multiple doctors, some of the capsule systems that I'm using in my practice. There were originally two capsule systems, which have been around since about 1991. Over the past 2 years, two new companies have come up with capsule systems, both of which I am currently using in my practice. And the reason for this video is sort of an unboxing so that physicians can understand exactly what's entailed and what my workflow looks like, because that's the main question, is how do these capsules work and how does it affect my workflow. Both capsules are excellent. The older capsules, the older systems are also excellent. I'm not going to make a commentary or really show the software. Again, this is really just an unboxing and to show the workflow. Today we're going to look at Capsocam Plus. That's the capsule we're going to be looking at. Capsocam Plus is made by a company called Capsovision. They've been around for a few years. They've been FDA approved in the United States for about 1 year, and I've been using it in my practice for about 6 months. I really like the system. Again, there are some pros and cons to all of the systems. I'm not here to review those pros and cons or give an editorial on what I think of the system. This is just an explanation. The Capsocam system does not use a recorder. The Capsocam system is a capsule that you ingest. The capsule needs to be retrieved at the end of the procedure. There are two ways that the capsule can be processed after retrieval. Those two methods are to actually process the capsule in the office and download the video, or have the patient mail the capsule to California, where the center is, a download center, and the capsule can then be viewed, all HIPAA compliant, of course, via the internet, downloaded and viewed over the internet. So that's kind of the way we're going to show this video. So we're going to start with the unboxing here in my office. I've already sort of brought together all of the pieces that you need. The parts that go into the bag for the Capsocam include the box with the capsule. This has identification stickers for the capsule. This, we're going to show you, has to be entered into the internet software so that when the capsule gets sent back the identification is obviously built into the capsule. When the capsule goes back to California and they download it, we'll know which patient the capsule's for. So this is the box with the capsule. This is the retrieval receptacle. I can open this for you. This is a package that, again, obviously I would give it to the patient and the patient would open it. This is what the capsule goes into after it's retrieved. This goes back into the cellophane and goes into a FedEx package and is shipped back to California. So that's the second part of the package. This is a hat. This goes on the toilet when the patient goes to the bathroom after the capsule's ingested. This is where the capsule is retrieved. This is a cup, which is used to pour water over the capsule so it's visibly seen after excreted. And this is a magnetic wand. The wand is used so that the patient does not have to touch anything as they're retrieving the capsule. So this is how the patient retrieves the capsule, and it goes into the receptacle. The exact system of capsule retrieval is on a website with the company. We'll leave a little link in this video so you can view that. I'm not going to go through that at this time. The next part of the video, we're going to go to the computer. I'm going to show you how we enter the information and get the FedEx label to give to the patient so that it can send it back to the company. This is our computer room, our capsule room, where we do most of our capsule readings and capsule work. At this point, we just need to input the information for the patient into the capsule cloud and send the information to Capsovision so that when they receive the capsule from the patient, they'll be all ready to produce the video and let us read it. This is what the download screen looks like on the capsule cloud. It really just asks for the patient's name, my name, the capsule serial number, which is on the capsule box. So we enter all of this information and this gets processed. Now, I'm not going to actually demonstrate the printing here, but after we finish entering this information, we go to the computer. The computer prints us a nice FedEx label. So we're kind of done. We take the FedEx label, we put it into into a FedEx slip, and this actually goes into the bag that's given to the patient, so that when they're finished with the study, they send the study to CapsoVision, who processes the capsule for us and allows us to download the video to view the images. Aiden, how are you? Good to see you.
Nice to meet you, Doc.
Thank you for coming in today. So Aiden's here. He's our demo patient. He's going to help me. He's actually not doing a capsule, but he's going to help me roll through the technique and our process and how we go about doing this. So the first thing we're going to do, I've already discussed the risk with Aiden. He's just going to sign the consent form. Always important, obviously, to get informed consent before doing a procedure. Thank you, Aiden. The next step is we need to go through the process for capsule retrieval. I discussed that a little bit earlier in the video. I have everything. The company really is great about giving us the information online. So I have an iPad. We have the actual video loaded onto the iPad. It's actually streamed through the web. So I'm going to give Aiden the iPad. We're going to step out of the room for a minute. He's going to watch the video, and then we're going to have him do the procedure. So this is the capsule kit. We discussed this earlier. I'm going to leave this on the side for Aiden. This is the actual capsule. It's important, there's a number on the capsule, which, as you saw earlier in the video, we entered into the capsule cloud so that CapsoVision can identify the capsule when they get it. We open the box and remove the capsule. There are more stickers on the outside. One of these stickers will go in the patient chart, so I have it. We open up the capsule, like so. We then take the plastic coating off. Of course, we're going to use a glove. The glove is for sterility. Obviously, Aiden does not want my hands on his capsule, and also to not smudge any of the optics. I don't know if you can see the capsule, but this is the capsule, and we wait until the light starts blinking. Perfect. You see the capsule blinking, we're ready to go. Aiden's not really going to touch the capsule. He's not supposed to. He's going to open his mouth. We're not actually giving him the capsule, but at this point, he would swallow the capsule, and that would be the beginning of the procedure. He would wash that down with an 8-ounce glass of water. Okay. At this point, Aiden is fully educated based on the video. We've discussed the risk and the benefit. This is Aiden's kit. Again, as discussed earlier, there is a FedEx package and a slip. When he finishes the capsule, I'll explain to him that the capsule will go back into the packaging, exactly as described by me in the video, and then sent back to California, at which point the video can be downloaded. I'll get an email saying that the video is ready and I can download it and watch the study. All right, Aiden, so as we discussed, you're doing your capsule procedure now. You can go about your regular activity. You can do anything you normally would do during the day. You need to keep your kit with you so you can retrieve the capsule. You know how to do that. If you have any questions or concerns, there's a toll-free number on the package information that you could call. I gave you the information for the video where you can access that online if you want to watch it again. When you're done with the capsule, you put it back into the containers described, and you're going to mail it back to California in the FedEx package that we gave you.
Okay.
Thank you. Any questions?
No, thank you very much, Doctor.
All right, very good. So these are just my closing statements on the Capsocam system. Capsocam system, as I think you've seen, is pretty easy to set up. You just need to input the information into the capsule cloud. You print the FedEx label. The patient swallows the capsule. Patient goes about their day. They're not hooked up to a harness. There's no monitor. The benefit to the system is that, number one, and there are many benefits, I'm not going to summarize all of them here, but number one, you can do as many capsules as you want. You're not limited by the number of receivers that you have. Number two, the patient's free to go about their day. They can do their normal activity. Number three, the patient actually doesn't have to come back to the office. There's no download time, and I think the workflow is much shorter and easier. The skill of the staff can be much lower, and a lot of, not only the download is web-based, but the actual instructional video that the company has online is great, and that's all over the internet. As you saw in my demonstration, we actually use an iPad in the office. The downside, if I had to give a negative about the system, is the capsule retrieval. I haven't had much pushback. Patients have not had a problem with it. And again, I've had a very good experience with Capsocam over the past year of use. If you have any questions, please feel free to contact the company. All of the information is on their website.